Colorectal cancer, also known as bowel cancer, colon cancer, it's the development of cancer from the colon or rectum, and March is Colorectal Cancer Awareness Month. Joining me now are Georgia Dixon, nurse practitioner, Dr. Sripriya Santhanam, both with the Baylor Scott and White Health System, and we're going to talk a little bit about this issue because it's something we all need to be aware of and can be screened for, but also particularly for African Americans. Is that correct?
Yes.
Correct. So why is it people are kind of reluctant to take the tests?
There's been, historically, there's been some resistance to many of the screening techniques that are available. Predominantly, I would say the colonoscopy has met with a lot of resistance, especially in African American men. There's been quite a few studies that have shown that they are more likely to prefer to take home stool-based tests. And we do have a couple which are very sensitive, but still, the colonoscopy is the standard diagnostic test that will detect most of the colon cancers, especially because the scope actually traverses the entire colon, including the right side, which is where studies have again showed that African Americans tend to have more right-sided colon cancers, and hence the need to definitely undergo a colonoscopy rather than any of the other tests.
Mm-hmm. And Georgia, I mean, your practice is with gastroenterology,
yes.
And so there have been a lot of changes in the prep. I mean, that's what kind of holds a lot of people back, just what you have to do the day before.
Of course.
A colonoscopy.
A lot of people are not liking the invasive procedure of the colonoscopy, so we have two great options. They could do the FIT testing. It's a non-invasive testing where they'll take a stool sample, and it's in the comfort of their own home, and we're looking for traces of blood in that stool sample. And then another thing that came out in 2014 was a Cologuard, and that test is a stool DNA test to test the DNA of colon cancer that's shed in the stool. Now, this is also non-invasive. They can do it at home. It's sent to the lab, and we look for traces of DNA. Now, if there is DNA showing that there's colon cancer, we're going to recommend that you take a colonoscopy.
Right, and do further testing. And there are, of course, advanced treatments now.
Lots of advanced treatments. There's now a lot of emphasis on molecular and biologic biomarkers that we can test for in the tumor specimen that allow us to use advanced therapeutics and immunotherapy even, which have come about in the recent years. So there's definitely a lot of advances, a lot of new drugs being developed and researched on for colon cancer. So the impetus to really focus on this disease, which is so highly curable, 90% chance of cure if detected early, and a huge population that is at risk in our country.
Right.
So,
well, as in October, we kind of focus on breast cancer awareness, and I know the number of mammograms that people go get, goes up. Hopefully in March, the same thing. And so how can folks get in touch with you to get maybe some of these tests to do at home?
So Baylor Scott and White, you could come to your physician, even if your primary physician, at any local clinic. Go to your primary and ask to be tested for these. And there are warning signs that we must watch out for, like some persistent abdominal pain, nausea, vomiting, weight loss, anemia. And if you have any change in bowel habits, please report these to your primary. That's very important.
Oh, it's just crucial to get that spotted and treated and cured in so many cases.
Cured.
Thank you both so much for coming to be with us. When we come